All right, we're good to go. What's up, guys? It's Joe Kenny here, Vitality Sciences. Today we have the man, Ryan Smith from Tailor Made Pharmacies. He is basically on the forefront of medicine. What they're doing over there is just awesome, and I can't be more thankful for him taking the time to do this video for us. Today we're just going to talk about, some of the peptides most frequently used here at Vitality Sciences, and then we're going to also see if Ryan can shed some light on some new ones. So, Ryan, if you want to go ahead and introduce yourself.
Yeah. I appreciate you having me. And it's always a pleasure to work with Vitality Sciences and you as well. And I got a lot of interesting stuff to talk about. My background is a medical in nature and a biochemist in nature. I did a lot of background and protein biosynthesis, but then really got into medicine and this field of integrated medicine. And we did that through starting Tailor Made Compounding, which is a compounding pharmacy that we started around 3.5 years ago. Since then, we're the 4th fastest growing company in healthcare, and we are the 21st fastest growing private business in the US. And so we're pretty proud of that. And the reason is we have great products I know that you use. And so I'd love to talk about them a little bit more.
Funny you say that. I actually remember, I don't know if you remember this, but we had first met at the Anti-Aging Forum, I believe it was in Orlando. It was like a smaller one. You guys were just starting off. Before all the peptides came out, I remember you guys were there. You guys were talking about IGF-1. And I'm like, there's no way. I was like, that's just like way too cool. Like no one's doing that, And then here we are, almost three years later, I think, 2 years.
Yeah, exactly. It's been just about that time. And and like I said, the science has grown like just as much as we have. And so it's been fun to watch that grow and see how different clinics and practitioners are using it.
Definitely. Yeah. I mean, I've been in this industry for 10 years. I've seen it all from, working with patients, doing the marketing. So I've seen it from all angles and whatnot. And, where we're at right now, I can be honest with you, it's almost crazy to me that we've been doing the way we have for so long. And then now this is what we have access to, just how limited it was back then. It's awesome to even think about what's in the future. So.
It is, yeah, it's cool. I think that, the next couple of years will show a lot of improvements, even just what we're doing, some of the new things I know that you and I talk about with the MOTSC and some of these other products, a lot of hope for preventative medicine.
It's awesome.
Yeah.
Cool. All right. So what I was going to do is, the biggest thing for us is, a lot of patients we talk to, everyone hears the word growth hormone, HGH, and with HGH there's that stigma to it, and growth hormone is just, it's not for everybody, it's crazy expensive. The side effects are just not worth it. It's just, you can get such a better result with these peptides. So that's why I was going to kind of let you jump in, explain what a peptide is, why we're using them, whatnot with the case. And then I have frequent ones, which I'm sure that we do a lot here. And if there's any, that you want to throw in, new stuff, whatever, please feel free. So
yeah, absolutely. So just starting with the bare basics, a peptide is sort of defined biochemically as an amino acid sequence less than 50 amino acids. And so, with 21 naturally occurring amino acids, you have a lot of combinations and permutations of that. And so, even in the body, they've isolated over 7,000. And so the body's natural signaling molecules, as it relates to growth hormone, they give us a really, really good option to increase our natural levels of growth hormone by encouraging the pituitary to actually do its job. As you hit 26 and your late 20s, that growth hormone just drops and bottoms out, right? Yeah, you know it as well as anyone. And so, you actually have to start that replacement in order to get some of those clinical, effects. So improve sleep, improve repair and recovery, the body composition changes. And so those are all sort of tied to, growth hormone deficiencies. And so the peptides give you an option to increase that a little bit naturally without the side effects, more cost effective. And then beyond that, you're just encouraging your body to do what it should do naturally.
Yeah, the way we describe it to patients is essentially, we're jump starting an old engine, we're getting things refiring again. And, that's the easiest way to describe without getting technical with the patients, because the biggest question is, well, what does it do? And for me to say it does this and affects this and that, they just want to know the bottom line. So, and you just hit the nail on the head, everything, basically like as we get old, that's just everything you talked about is an effect of getting old, less growth hormone levels. So cool. So let's just start off, tell us, what are the most frequently used peptides that you can see in my industry, in my world?
Yeah, definitely. So, we already talked a little bit more about those growth hormone secretagogues, and those are widely prescribed just due to the effects that they can have on just about everything, right? Metabolic effects, preventing of cardiovascular disease, whatever it might be, repair and recovery. I mean, there are a lot of different things that those can affect, and so those are probably number one. Beyond that, you have a couple other things now which are really, really widely prescribed. Things like the bremelanotide PT141 for sexual function. That was approved just 6 or 7 weeks ago by the FDA, and it's something that you've known about for a long, long time, right? And so we're now seeing wide-scale adoption of some of those things. And then in addition to that, the thymosin beta-4 and thymosin alpha-1, 2 FDA-approved products which have orphan drug approval, and so they're not used probably as much as they should in traditional medicine, but present some awesome strategies for your patients in case they're trying to, recover from, injuries or small or muscle tears, if they're trying to improve their immune system, even if they're trying to have a supportive, therapy for cancer. And so a lot of really good options across the board, but I would say that those tend to be the biggest in class. And then lastly, the BPC 157 for its many pleiotropic and broad benefits as well, from repair and recovery to modulating serotonin to helping with GI upset. You can't go wrong with that one as well.
Okay, cool. So just kind of recap that. So, BPC from the last one, BPC, it comes in two forms, a pill and also an injection being subcutaneous. So specifically, the pill would be more for digestive issues, people with, say, like, ulcers or, for instance, my dad had stomach issues his entire life. Actually just got to the point probably about a year ago. This is before he'd come back down to Florida. He was still living in New York. Actually had his gallbladder removed. Wait, not gallbladder. What was it? Was it gallbladder? Yeah, it was gallbladder. Anyways, it was an organ that secretes a certain type of fluid to help break down food, if you will. They took it out, still having the gut problems. He was literally on the BPC, I kid you not, in the capsule for, I think it was 8 days. And he was just raving about it. I haven't had a normal bowel, not in those words, but in, almost 30 years, I can't believe I went through this, blah, blah, blah. So pill really for digestive. The injections, how would you go about explaining the injections specifically? What's it for?
Yeah, so just even to take a little step back, the BPC is one of the very, very few peptides which does have oral bioavailability. So that's a pretty cool thing in and of itself. But a lot of people still like the injections for the musculoskeletal type treatments. Things like ligament and tendon injuries, even if you tear a muscle. And so a lot of people tend to go, I think, say more injectable, more toward the side of injury. A lot of our physicians, in case they're trying to treat anything that is sort of injury related.
Very cool. So, a question that comes up a lot with the BPC, the injections, for instance, and people are always on Google, which I'm sure you know too. And, and this is a question too, BPC. So say a guy has shoulder rotator cuff surgery. Do you guys actually recommend doing subcutaneous in that area, or does it doesn't matter?
Yeah, a lot of our practitioners will try and go as close to the area as possible. But with that being said, the clinical literature that we've seen shows that it doesn't really matter. In the clinical literature, it's been described as 3 ways: orally bioavailable, subcutaneously bioavailable, and then peritoneally bioavailable. So injections sort of into the peritoneal cavity. All of them have shown efficacy. And so it looks like as long as you're getting systemic absorption, you're getting a good result. And so it tends to clinics here and there that you can choose based on the patient. But as long as you're getting blood level increased, then we traditionally will see a benefit.
Very cool. All right. So kind of recap what you said there. BPC, again, pill is going to be digestive, in the injections or overall healing. So, another question too, is there a time limit on it? Is there a length? If you take it too long, can it be harmful? I'll let you jump in and answer those questions.
Yeah, and that's difficult. There's been up to phase 3 clinical trials with this for ulcerative colitis and some other things, but those have not been released. They're owned by a company called Plavia in Croatia, as they continue to seek, IND approval and FDA approval for a lot of different things, but particularly ulcerative colitis. And so there doesn't look to be any toxicity or any negative side effects described in the clinical literature. So, I think that as a general rule of thumb, people still like to cycle to be extra cautious. But with that being said, it looks to be a very, very safe and long-lasting therapy.
Okay, and how would you recommend that cycle? Would you recommend it, 4 weeks, 12 weeks? Obviously, if someone's, going in for a shoulder surgery, the length of until, they're back to, where they started essentially. So again, what do you recommend as far as the duration?
Yeah, it's difficult for our practitioners. They generally, I would say, tend to stick to prescribing habits, which we'll say for musculoskeletal things, they'll tend to be, 8 to 12 weeks protocols. For more of the GI related things, those can be even consistently and ongoing. A lot of people will try and mitigate the symptoms and then try and titrate down so that the cost and frequency of dosing is as minimal as possible while still getting a great effect. And so, those two are handled very, very much differently. Some people can see, and we've seen anecdotal report after anecdotal report of people calling us and saying, hey, I did the BPC for a week and my injury was, had 90% pain reduction. And so sometimes you can just use a really, really short course, but other times, especially for the GI things, it's more of a consistent therapy.
Exactly. Yeah. And that was the big thing my father noticed too. He was like, well, he missed a week when he went back up to New York. Same thing, digestive issue started up again. So I'm with you on that. Cool. All right. So that's BPC. So guys, basically BPC is, let's call it the Wolverine of the peptides. It's that superhuman healing. Okay. Next one I think I really want to get into is the thymosins. All right. So there's two, there's the alpha and then there's the beta. I'll let you kind of describe the alpha and the beta and what's the difference between them.
Yeah, so they're both isolated from thymus, the thymus, I guess, collection of different peptides. There's a lot of thymus peptides. So while they share a name, they're actually pretty different in what they do. The thymosin alpha-1 is probably my favorite of all the peptides. It's FDA approved for malignant melanoma, hepatitis C, and hepatitis B. And in addition to those effects, it's been studied to help with autoimmunity. It's been shown to help with cancers of sort of all types. It's been shown to help increase the efficacy rate of vaccines, and all of which, having essentially little to no side effects. And some people even claim it has, less side effects than placebo. And so with that being said, it is a sort of a product which can be used in a variety of cases for a variety of benefits with really no downside. And so it's an amazing, amazing product, which, we are using more and more and more as people sort of learn about all that it can do.
Yeah, I know we actually, guys, we've been trying to get this meeting on both sides. We've whatnot, but Ryan was sick the other day, and I'm going to load up, on the alpha. So did it help?
Yeah, absolutely. And it's one of those things that I don't travel without because, if you feel something coming on, then you can nip it in the bud. And I think that, that's just even, maybe a more reckless strategy to it, but it has people with autoimmunity, Hashimoto's, lupus, psoriatic arthritis. We've seen improvements. I think that we've seen improvements with just about all types of cancer. We've seen, improvements obviously in people who get sick or have some type of viral illness, but, we really don't see any negative side effects of it, which is also another huge positive.
Huge. All right. So what would you say about the beta? What would be the difference on beta?
Yeah, so thymosin beta-4 is unfortunately, I think, got a negative connotation just because of its history in sports performance. Mm-hmm. Thymosin beta-4 is really, really pleiotropic, so it does a lot of different things. One of the main things it does is an actin sequestering protein, and so it can sort of help rebuild that muscular cytoskeleton. And so as a result, you get a lot of delayed onset muscle soreness. You repair from injury, you repair from high strain athletic events. And so it does a lot in terms of helping repair muscle. But even beyond that, it has an effect on, increasing cellular levels of ATP for energy. It has a lot of studies in neuropathy and traumatic brain injury. And even beyond that, it's got studies in, post myocardial infarction in terms of helping heal the heart. And so it's an awesome product, and it's a very, very natural. Both of these things are, I want to reiterate, produced in the body naturally. And the thymosin beta-4 is actually the first peptide which is upregulated whenever you get an injury anywhere, even if it's just a cut in your skin. And so we're just sort of taking advantage of that natural biology to sort of help patients repair and recover.
Very cool. Something I could put in there too, not as more layman's terms, my last triathlon that I competed in, I actually did too. And I went, without peptides, and then I went the second one with peptides. The second one, keep in mind, I did take first place, and this isn't competitive. This is all for fun. But what I noticed personally as myself was I was able to get in one extra day of training, which is huge. If you're actually training like that, an extra day, you times that, figure that over a 6-month period. I mean, that's what, an extra 4 days a month. It's an extra 24 training sessions. So in some world, that's an extra 2 to 3 weeks. So, and it was a huge benefit. So yeah, definitely, I love that. That was actually probably one of my favorite peptides too as well. So. All right, so we got the healing, got the BPC, thymosin. Let's do what I feel like is our favorite here with the patients, the tesamorelin. The tesamorelin, as with weight loss, we've been doing in a lot of our therapies, and the results are just tremendous. So, kind of let you jump in on the tesamorelin.
Yeah, absolutely. So whenever we talk about these growth hormone releasing peptides, the one that's by far the gold standard in that category is the tesamorelin. It's a little bit expensive, but the results you get are second to none. The average IGF-1 increase is 181 points, which is absolutely massive. And if you were going to do that with growth hormone, you'd spend a lot of money. And then beyond that, you get reductions in carotid intermedia thickness, reduction in triglycerides, reduction in C-reactive protein, all of these things which decrease your risk of heart attack and stroke. And then beyond that, you also are just sort of melting that visceral adipose tissue around the midsection. And so, and that is and that's the a great benefit of it, in addition to all the more of the muscle building benefits and the other body comp benefits. And so it is by far probably the most reliable growth hormone secretagogue that is sort of on the market.
Yeah, it's awesome. And cool, guys. It's actually when you actually get your package and it comes from the pharmacy, the labeling on it, I can't tell you how cool it is. It's so exciting to see. It's 6 individual vials on one kit. It's 1 vial per day, 6 days a week. So if you start on Monday, you'll end on a Saturday. You'll take a Sunday off, and it comes with a vial of backwater. Backwater is mixed at a 0.6 ml diluent, and it's actually injected at a 0.5, which is dosed perfectly by Ryan, the genius. And that's at night before bed, 90 minutes post your last meal. Ryan, why do we have got people inject the releasers at night, 90 minutes after their last meal?
Sure, yeah. So 2 reasons. One is that naturally your body secretes the most growth hormone right after you go to bed. That's the biggest natural peak it would have of growth hormones. So we want to mimic that with this product and make that peak a little bit bigger, but still at the same time. The other part of it is insulin will greatly increase somatostatin, which inhibits the growth hormone response. And so we don't want insulin to be in the system when we're dosing this product. And so that's the reason we recommend doing it on an empty stomach, because you don't have any insulin in your system, because it's sort of hopefully done its job after your meal and it's sort of coming down.
Perfect. That's awesome. Ryan, what's the length? How long do you guys recommend? When do people actually start seeing results? There's a lot of stuff online too that will tell you can only take tesamorelin for 2 to 4 weeks at a time. What do you guys see is optimal as far as for a patient to, from what you've seen, reach full benefit of the tesamorelin? What's the length that you guys recommend? Is there cut it off, no more? Is there a sweet spot? I'll let you take over.
Yeah, no, definitely. I think that with one important thing to note is that with a lot of the traditional growth hormone secretagogue therapies, you'd have needed to take breaks, and you have needed to sort of cycle these things, because you don't want to cause your body to become unresponsive, what they call tachyphylaxis, or the building up of resistance. What we see is that is mostly mitigated via another receptor on the pituitary. So that growth hormone secretagogue receptor, the tesamorelin mimics growth hormone releasing hormone from the hypothalamus. And so that doesn't downregulate as much. And so you can actually hit that receptor pretty hard, pretty heavy for a long period of time without actually getting any downregulation. And so you can see some of these, the best example are these AIDS patients, HIV AIDS patients who have been prescribed tesamorelin to help with their AIDS lipodystrophy. They've been taking these things for years consistently at even a larger dose than we would recommend anywhere else, and they're still responsive. And so you can really go with tesamorelin for a long period of time without having to worry, but still, because of the cost and because of how effective it is, people still like to cycle it.
Yeah, very much so. Which is going to actually bring me into my next thing. So typically what we see here, most of our patients, their therapies are going to be dictated around 10 weeks. We're not just saying, you're going to get testosterone with it, but, most testosterone therapies come with a 10 ml vial. The standard dosage is 200 milligrams a week, so a 1 ml injection. Typically, what's done is most patients like to order in increments of 10. So what we've seen a great result with is 6 weeks of the Ipamorelin, and then kind of finishing up with 4 weeks of the CJC Ipamorelin. That's a 2 milligram, and which I will jump us into our next topic, CJC IPAM. The way we've been kind of talking about it is, testosterone, say, let's more geared towards initial weight loss, really get that up to its maximum. In your CJC Ipamorelin would be more of like an anti-aging, a little bit less work, comes in a pre-mixed vial. There's no mixing. All you have to do is walk to your fridge, pull it out and inject. You're able to travel with that vial, throw it in your carry-on, as long as it doesn't get past room temperature, you're good to go. So I'll kind of let you take over and talk about.
I don't have a ton to add because I think you sort of said it all, but I think that the one thing I would say that we don't see with the Ipamorelin, we do see with the CJC, is just that sleep benefit. People having better deep wave sleep, and people like me who measure with the Oura Ring and things like that can see it pretty evidently. Whenever I take the CJC Ipamorelin, my deep wave sleep will go up by 5 to 10%, and so that is one benefit that I don't necessarily see with the Ipamorelin, but it is a great asset to have as part of a protocol with the CJC Ipamorelin.
Yeah, so that's like the first thing, guys, that when patients start off, we're always checking in, whatnot. As soon as they get started in their CJ IPA, first thing they say is, I haven't slept this good in years. More vivid dreams. You're actually waking up rested, guys. I'm sure, as most of you guys can, all of us can attribute, with our lives, stress, whatever, we're not sleeping. And that's probably what they're actually seeing studies now. The biggest problem that we're having here in this country is people are not sleeping enough. So, again, the biggest thing that we see, and first is, again, the sleep improvements, the rested feeling. So, it comes in like I said, 2 milligram vial. It's dosed at 5 days a week, Monday through Friday. It's a 0.10, so 1/10 of an ml injection at night before bed. Again, 90 minutes after your last meal. So, Ryan, is there a length of time that you guys recommend running that for? Is it good? Is it ideally, I know most people truly are interested in the compositional changes, which really doesn't happen between months 3 and 6, but is there a recommended, hey, stop, this is too much, or hey, this is something you could run all the time, budget allocated? Again, what can you see or shed some light on?
Definitely. And again, just like we sort of talked about the Ipamorelin, this one sort of depends on the Ipamorelin dose. And so, as long as most people don't exceed sort of 400 micrograms a day of the Ipamorelin, you really don't see any tachyphylaxis. The other thing is you also, if you dose it with a growth hormone releasing hormone analog like the CJC, you get less downregulation as well. And so if you're doing a protocol that's 5 days on, 2 days off, that's a pretty sustainable protocol and can be used really for a long time.
Very cool. Very cool. All right, we got that one covered. CJC, BPC, the thymosin. I know, and I don't want to jump into it, whatnot, but I know there's some really cool ones that just came out that basically sold out within the first week. Not sold out, but we're gone. I have a good friend. His name's Wayne. He actually has a clinic in New York. He's like, you have to try this new peptide. It's awesome. Check it out. I talked to the doctor, had him put the script, and he's like, Joe, there's none left at the pharmacy. Back order. So, so what can you shed some light on that MOTS-C? Actually, that's brand new to me, and I'd love to hear about it.
Yeah, so the MOTS-C is part of a category of mitochondrial peptides. And so what happens is whenever your mitochondria feel metabolic stress, for instance, way too high sugar, insulin resistance, it can secrete this peptide, MOTS-C, which essentially causes mitochondrial biogenesis. It increases ACAR, increases PGC1 alpha, and then increases basically the ability of the mitochondria to do its job. And so what you do is you have increased energy expenditure, you have better insulin sensitivity. It also works sort of indirectly at metabolizing different fatty acids. And so, it's highly associated with better reactions to metabolic stress and metabolic injuries. And so if you're overweight or you're trying to lose some of that weight, that can sort of assist in that. The other really, really cool thing about it is that it's a polymorphism. So in some Japanese populations, they have a polymorphism which actually causes them to secrete more of the MOTSC than normal. And it just so happens that they are also highly associated with longer lifespans, living to 110 to 120, and so there seems to be a link between maybe this mitochondrial survival and also longer lifespans.
Very cool. And what's the length of therapy on that one? Because I think I had read, and I was briefly got a chance. I barely have any time, but I got to catch some of your webinar. And it was something only like it has to be done like once a year, twice a year. How does that work?
Yeah, see, it's still very, very new, but most people tend to do it just 1 month, especially if they're trying to gauge insulin sensitivity issues. And we've seen pretty good results with this too. A lot of people who do the Libre freestyle continuous glucose monitors get to see that area under curve after a meal significantly decrease because they're getting better insulin sensitivity. And so their cells are reacting more to that insulin, and you don't have sustained high glucose levels for a long period of time.
Very cool. Let me take some notes here. That is a new one. What else do we got here? MK677. It's not really a peptide. That would be a SARM, selective androgen receptor mediator.
Yeah, so that's an interesting one. So you're right, it's not a peptide, but it's actually not a SARM either. Technically, it's just a small molecule drug. Oh, I guess that it wouldn't fit the SARM category because it's working much like Ipamorelin to increase growth hormone secretion. And so, most people use it with, SARM stacks, and because of its ability to sort of help build lean muscle mass. It can increase those growth hormone, increase those IGF-1 levels, and as a result, people tend to gain lean muscle mass, tend to gain a little bit of weight while keeping their fat mass relatively consistent. And so for people, who are sarcopenic or elderly, or even just want to add a few pounds in the gym, that's more of, I would say, the MK677 target demographic.
Okay. What's the length of therapy on that? Is there a dosaging? I mean,
sure. Yeah, most of the studies have been done at around 25 milligrams. And that's usually in men, but pretty much it has the same, a lot of studies show the same dosage regardless of sex, age, or weight. And most people will do that actually for a shorter duration than most, just because you don't want to cause any negative feedback and become unresponsive to that particular medication. So some people will do, anywhere from 6 to 8 weeks worth of therapy.
6 to 8 weeks. Very cool. All right. What else do we got here? I know and I said it all wrong for using me, but it's MOTS-C.
Yeah, but people call it the MOTS-C or the MOTS-C or whatever it is.
Everyone's pretty much, I've gathered through, just recently with the peptides, like everyone's got their own name for them. Everyone's got their own.
Exactly.
Awesome. Actually shed some real light on this. What about the GHK-CU? I know I saw that was an awesome one. I saw, for me, I'm going bald, but, the benefits of hair, but also it acts on I believe it was copper enzyme, and it actually helps with scarring and actually helps with, for instance, say someone's going in for a surgery, wound healing. You want to shed some light on that one for us?
Yeah, so it works on a couple different ways. It has a lot of genetic changes which can sort of help with inflammation and anti-cancer. But the real reason that most of our physicians tend to use it is because of its benefit on hair. As you said, it's been shown to be better than 5% minoxidil. So for that's traditionally the over-the-counter Rogaine type material products you would get. But beyond that, it has a really, really good effect on tissue repair and remodeling. And so there's been studies to show that it helps with ACL repair. And then another really, really big reason, and probably where it's used most, is its ability to help increase collagen and skin appearance, reducing wrinkles. It causes a 70% increase in collagen, which is pretty crazy, unheard of. Around a 24% reduction in fine lines and wrinkles. And beyond all of that, it also has been studied head-to-head versus retinoic acid and vitamin C, which are pretty standard dermatological formulations, and outperformed. And so it's good for cosmetics, it's good for repair and recovery, and it might even have some other genetic effects which are sort of yet to be seen.
I want it. What's the length of therapy on that one too? Is that one also, I saw too, that's one that basically what is done every month?
Yes. So yeah, if you're using it topically, I mean, people have been using it for hair for years on end. Same with cosmetic creams. You can really use it for any extended duration, and use it as a general anti-aging protocol, right, to reduce those fine lines and wrinkles. Some people, I would say the more aggressive people, would also do typically some injection protocols for more of the genetic effects, and the repair and recovery of things like ACL injuries. And those are really, really short courses, usually 4 to 6 weeks.
Really? Very cool. So you're saying it actually comes in two forms.
It does.
It comes in a cream for topically. So for a guy like myself, premature balding, would actually rub it on the areas where, would you rub it on your whole head? Would you rub it on your face for scarring? Like what?
Sure. Yeah, so it comes in a couple different formulations. A lot of people like it as a foam for the hair product, to sort of massage under the scalp and to hit those areas. And by doing that, you can sort of increase that anagen phase of the hair follicle and hold retention of hair follicles. So make, help regrow hair, but also make it look thicker. And so the foam is popular. The cream is popular for wound healing, as well as the general cosmetic effects for anti-wrinkles. And then
let me jump in. So I'm sorry to interrupt you, but you're saying actually putting it on like
absolutely
an open wound or over something that's scarred over?
Yeah, a little bit of both. People will do it, especially if it's got a sort of a scab on it or something like that. People will apply it to reduce the risk of scarring, or even after a procedure, if you've been, cut into at all, people will do it. I have actually a really interesting story about this one. I had a biopsy on my nose, routine biopsy, but before the results even came back, you couldn't even tell that I had an incision because it healed so quickly. And so I'm a big fan of this one for its tissue repair and recovery effects, even topically.
Really? That's awesome. All right. So just a recap on that one. Topically, hair, wrinkles, 70% increase in collagen. What would be the extreme benefit of someone injecting it? Now, is that also the same protocol as, topically? You said the 4 to 6 weeks.
Yeah, so the injection protocol is, I would say, hardly ever used. The people who are using it are more of trying to repair Achilles tendon tears, ACL, MCL injuries, those types of things that you can't get to really, really easily with the topical creams. But I also should note there's one study I always sort of like to point to, which where they induced wound formation on the back of some rats' necks. Then they applied the GHK topically to the thighs of the animals. And even with the topical administration in a different area, they saw reduced wound healing times on the back of these rats' necks. And so we know that it's having sort of a systemic effect on tissue repair and remodeling, even if you're not doing the subcutaneous injections.
Very cool. All right. Ryan, is there anything else? Anything new? Anything you would like to shed light on? I mean, do we cover everything? What do you think? I know there's so many peptides out there, guys, and if Ryan blesses us, I would love to get with Ryan, hopefully like maybe once a month and do like a product, like a quick something. We talk about something, bounce it off, because like I said, guys, Ryan is. I've been doing this a long time. I'm actually going to stare into the camera. In all my years, and of anybody I've talked to, spoken with, whatnot, Ryan is it. Okay, he is it when it comes to regenerative, anti-aging, anything to do with this industry, guys. So, anything else you got for us? Or
yeah, I do, and two things that are coming out, which I definitely want to put on your radar because I think that they're going to be huge. One that's ready now is called DHHB. It's an anti-anxiety product which is derived from magnolia bark. And I can guarantee you that if your patients try it, they will feel relaxed. It's anti-anxiety. It is not like a benzodiazepine, and it's not controlled. It's just a really, really nice feeling to alleviate some of those high stress moments. And so, I'll definitely make sure that we connect on that, and I get you a bottle. The other piece of it is there's another product coming out, which I'm very, very excited about, called 5-amino-1-MQ. And this is a really, really interesting product from a scientific level. As you age, your white adipose tissue tends to upregulate this enzyme. And as a result, you become a little bit less metabolically active. Another really popular thing now is this NAD/NADH ratio in the mitochondria. And this product actually can change that and restore the NAD ratio to where you were at a younger state, sort of earlier in your life. And so this product is going to be hopefully great for fat loss, great for, energy, but particularly for weight loss, and it's going to be orally bioavailable. So that's another one that you should definitely be on the lookout for.
So you're telling me patients don't have to sit through that terrible IV drip, the NID?
Exactly. Yeah, you don't have to sit, a couple hours and feel miserable. This one hopefully will change it from an intracellular perspective.
Very cool.
Yeah.
Awesome, guys. Personally, I know I want to thank Ryan. I appreciate this so much. And he says, hopefully we can get some more videos going like this. Guys, I appreciate you guys taking the time to watch this video. It's Vitality Sciences. You can reach us www.vitality-sciences.com. And Ryan from TaylorMade Compounding Pharmacies, he is the man.
Okay.
All right, I'm gonna actually hit stop recording so I can thank you, and then